Hey mamas, it's your CajunStork here. Are you wondering how newborn procedures at a birth center might be different than in a hospital birth? Well, today I'm going to talk to you about all the things that midwives do for your baby and how it compares to a hospital. But before I begin, my name is Midwife Kyra and I believe in truly natural birth because I know that it makes for better birth experiences. Consider subscribing to my YouTube channel and joining in today's conversation in the comments below. Oh, and don't forget to download my free birth packing and supply list in the description below. A lot of clients are curious that if midwives provide the same quality of care that hospitals provide for the newborn. The short answer is yes, absolutely. Now, I can't speak for every midwife in the country, but I can speak for my practice here. I'm located in Louisiana and I run a birth center called the Natural Birth House. Over here, we provide just about all of the same things that the hospital provides. So let me walk you through that so you have a little idea. So when the baby's born, we do immediate skin to skin and of course the golden hour. If you haven't seen my video on that, I'll be posting that in the description below on the benefits of the golden hour and the first hour skin to skin with mama. And we keep our voices low and we keep the lights dim and we really just try and allow all the love hormone oxytocin to flow. In addition to that, we also provide beds that are big enough for mom, dad, and baby to crawl in together. So that dad gets to be a part of that first hour bonding experience. After that first hour, at some point very shortly after, we'll be doing the newborn exam. So this is the same exam that the physicians do at the hospital on your baby. It's a head-to-toe assessment of the baby, not just checking from like the fontanelles or maybe teeth in your baby's mouth, which I have seen, but also, listening to the baby's heart, checking all the reflexes, and last but certainly not least, providing the newborn medications.
So look at this. Look at the bottom of his foot. I saw that earlier. I thought he did something. He has like paw prints. Look.
That's crazy.
And he's peeling, so that's a sign of a 41-weeker.
Both birth centers and hospitals in Louisiana provide eye ointment for the baby to prevent blindness from gonorrhea, as well as vitamin K, which we provide by injection. I'm sure you probably heard, and if you haven't, it's a good time to start doing some research, that there is an oral vitamin K that you can give your baby. However, it is a little bit more, kind of intensive. It's not like a one-time dose, it's multiple doses. So if families in a birth center choose to do oral vitamin K, we give them the research that they need and allow them to provide that to their babies themselves. At the newborn exam, we're weighing and measuring your baby too, and we'll be following up in the postpartum visits to make sure that your baby's growing appropriately for the first 6 weeks. Day 1 postpartum. So if you had a hospital birth, you're still in the hospital. If you've had an out-of-hospital birth, your midwife's coming to you to provide a postpartum visit. We use a machine, it's called a pulse oximeter, and it's called the CCHD screening. It's a heart defect screening that the hospital does too. And what it looks for is any possible heart defects that may have been missed on that 20-week anatomical ultrasound. Another test that we do that your pediatrician will want you to have done if you haven't done it at the hospital is the Pku Test. Now, you might know this test as the heel stick test, when they kind of lance your baby's foot and they drop the little droplets of blood onto these little circles right here. So we actually do this in your home as well. And so the heart screening and the PKU, all of the medications, all of the things that you would expect, good quality care, midwives in Louisiana provide the exact same quality of care. At the birth, the one thing birth centers do not provide like the hospital is the Hepatitis B vaccine. Even if my clients decide to follow the CDC recommended schedule for vaccinations, it's a simple process to start the Hepatitis B vaccine at the first pediatrician appointment sometime within the first few days after birth. Another thing that the hospital does that we don't do at the birth center is the hearing screen. Not that some of our midwives aren't trained on it, but the machine is quite costly and it's a lot easier for us to refer out. Another thing that the hospital does that we don't do at the birth center is ointment called triple dye. Triple dye is when they kind of use this black dye and they dye the baby's umbilical stump. And it's an antibacterial ointment that prevents infection. Over here, your midwife and her assistant and you guys are the only one touching your baby. So we just simply use alcohol and keep the cord stump dry with alcohol. And it's just not really necessary to add triple dye in this out-of-hospital environment. If you want to look a little bit deeper into how midwives provide quality care for babies, you can follow me over to this video right here where you'll get to see me do a newborn exam. Thanks for watching today. Bye-bye.